What's up, guys? Cade Moore with More Muscle, and today we'll be talking about seizures. Guys, seizures are, abnormal, involuntary, excessive electrical charges that, of the brain, guys. So this is very dangerous if you're driving, if you're swimming, if you're pregnant, or if you're doing something that's, serious, because you lose control, and especially if you're driving, you can lose control. If you're swimming, you can drown. So this is something very serious, guys. So a diagnosis of epilepsy, guys, is basically two unprovoked seizures at least 24 hours apart. So epilepsy, guys, is seizures that are happening, and unprovoked, guys. Unprovoked means it wasn't caused because of a fever, guys. So fevers cause seizures, right? So if you just had a random seizure without any cause, this is an unprovoked seizure, and then you can be diagnosed with epilepsy. Some risk factors for seizures include um, basically fever, cerebral edema, um, intracranial infection, hemorrhage, brain tumors, toxins or drugs, lead poisoning, tetanus, Shigella or Salmonella, metabolic conditions. Risk factors include trauma, hemorrhage, congenital defects, anoxia, infections, toxins, hypoglycemia injury. So hypoglycemia is low blood sugar, uremia, migraine, cardiovascular dysfunction. And guys, there's tonic-clonic seizures. They're without a warning. They're usually about 10 to 20 seconds. You're gonna see eyes that roll upward, loss of consciousness, contraction of the body, of the legs, of the neck. The mouth can snap shut, and possible piercing cry, flushing, loss of swallowing. Then there's the clonic phase, which usually is 30 to 50 seconds. This can last 30 minutes. Violent jerking, trunk and extremities, experience rhythmic contraction and relaxation. Can cause foaming in the mouth. You can urinate and go to the rest, number two, while having a seizure. And this can, cause confusion for several hours, impair fine motor movements, lack of coordination, possible vomiting, headache, sleep, and can cause sleep for several hours. You can feel tired and no recollection of the seizure, guys. There was a person that I knew that had a seizure disorder, and she consistently, like, it seemed like after every time she had a seizure, her memory decreased. So like, she'd have a seizure and then she wouldn't remember where her room was, and she was at the hospital with us. And so you want to make sure that you want to prevent seizures the best you can. And I'm going to show with you guys some ways that you can do that. So guys, we want to look for it's called an aura, guys. This is basically a feeling that you're gonna have a seizure. Like, for example, you might smell something, and that indicates that you're about to have a seizure, guys. It can be it's a warning sign, basically, like a throat, feeling in the throat, an odor that you smell, or a taste that you can taste, or a visual hallucination, or feelings of fear. But this is an aura, guys, and this is really important because it can, if you're having that feeling, you can know that a seizure's coming up. So you want to look up that. Another thing, guys, is febrile seizures, guys. That's from, an elevated temperature, as high as 102 degrees, 104 degrees, and duration can be about 15 to 20 seconds. My brother, actually, he had a seizure. I can't remember if he was getting his blood drawn or something like that, but he did have a seizure. And it was obviously, it's not a seizure disorder because it was provoked because I think he was getting his blood drawn or he was extremely sick. I can't remember exactly what happened, but I do know my brother had a seizure. I think it was when he got his blood drawn, if I remember correctly. But guys, that's the difference between unprovoked and provoked, guys, because unprovoked is when you didn't do anything to cause that seizure, or you don't have an insane fever, or you're not really sick. So guys, you're gonna look for some laboratory tests. You want a lead level, guys, because high levels of lead can cause seizures. A white blood cell count, blood glucose, metabolic panel, chromosomal analysis, and a toxicology screen, guys. These can all indicate, why you're having seizures. You want to get an electrocephalogram, EEG, because it's going to monitor your sleep and you can test you. And you want to help the client remain quiet and abstain from caffeine before this, and wash hair, because there's going to be electrodes on the head. You can do magnetic an MRI where you screen a chance for tumors or anything like that. Lumbar puncture, can tell you if you have meningitis, which is can cause seizures. Or a CT scan that can detect hemorrhages, infarctions, or malformations. So guys, if you know someone that has a seizure, you're taking care of someone with a seizure, let's talk about some things that you can do if they do have a seizure, guys. So you want to pad the rails of their bed, because they're going to be jerking and you don't want them to hit their head. You want to keep the bed or wherever they're at free of things that could cause injury. Like if they're sleeping, around like a light bulb or something and they hit their head on that light, you don't want that to happen. You want to have suction and oxygen available, guys. So oxygen can help with seizures, and suctioning can help because they might have that foam coming out of their mouth. You want to protect them from an injury. You want to place them on the floor and lay them on their side, guys. You always want to lay them on their side. And you don't want to put anything in their mouth when they're having a seizure. Because if they're laying on their back, they're going to smack their head back. If they're laying on their side, they're just going to be, jerking back and forth. You want to make sure their airway is patent so they can breathe. You want to prepare oral suctioning, and you want to restrict, you want to loosen restrictive clothes. And you don't want to attempt to, restrain the person that's having a seizure. You want to remove the child's glasses or, the person's glasses, administer oxygen, remain with the person. You want to note how long the seizure was and remain calm and reassure the caregivers. Post-seizure, you want to maintain the child in a side-laying position to facilitate oral secretions. So you want to make sure they're, spitting everything out and that stuff's not getting stuck in the throat. You want to monitor vital signs and position the head of the bed. Assess the head, including for injuries. You want to perform neurological checks, see how, if they know where they're at, and see if they're alert and oriented. You want to reorientate the client or whoever it is. You want to remain with the client. You do not offer foods or liquid until the client is completely awake and aware and the swallowing reflex has returned. Guys, we all have a gag reflex. This is important because it helps us not choke and aspirate. So we want to make sure that returns. And you want to determine if the client had an aura. Guys, I talked about the aura. And to see what the seizure, like where the seizure came from. You want to document the seizure. And guys, you want to assess for allergies. You can administer anti-epileptic drugs, guys. That's anti-seizure medication, guys. That includes diazepam, phenytoin, carbamazepine, valproic acid, and some other things, right? So there's that medication, guys. And this is the interesting thing. There's been studies that have shown that a ketogenic diet actually helps with preventing seizures. I think it was in the 1600s where basically they didn't know how seizures were and they'd lock people up with seizures. And basically they would go without food for a while and, they'd go off the ketones and basically their seizures went away. So guys, a ketogenic diet can actually help. I don't know exactly how that works. And you definitely have to talk to a doctor before you get, prescribed a ketogenic diet. But supposedly, a ketogenic diet has been shown to like completely get rid of seizures. And that's not all the time, but sometimes, it could help. Anyways, guys, After a seizure, you want to avoid any triggers that cause a seizure. And yeah, that's about it, guys. You want to promote optimal development. You want to make appropriate referrals and provide support for family or anything like that. And yeah, you just want to basically get ready. You can take anti-epileptic medications. You can get that CT scan, the ECG, where they monitor your brain activity. And those things can help with seizures. Anyways, guys, thanks for watching. Subscribe.